Hello everyone, let's try to solve this question together. So here we have a preterm infant who had a Broviac catheter placed. Broviac catheter is a tunnel central venous catheter, which is placed on this preterm infant. So looking at the pictures, the correct statement is, so four pictures are given, the x-ray of the chest, the picture of the neck, and the ultrasound picture with Doppler of the neck. What do you guys think? The correct response here is this is a normal Broviac. So basically, what's the course of Broviac? So if you guys remember, surgeons tunnel it and then make a small incision here and then put the catheter this way. So let's start one by one. So they said that the tip of the catheter is deep. If you see, the tip is in perfect placement, is at the junction of superior vena cava and right atrium. So this is perfect. So this is not the right choice. Incision look infective. One can debate, but this is a preterm infant. They are on, as you can see that this patient is on support. So they keep their neck bent all the time. So this is just, because of that. It doesn't look like an infective site. So that's deceptive. Although you can say there's a small nodule there, but this could be just in sign of slight inflammation, but doesn't look like infection. And like I said, this whitish area is also not infection. So this was deceptive. So that is wrong. Now what about if the line is obstructed? You see that the whole SVC or EJ is all patent, so it doesn't look like that the line is obstructed. So this is also not the right choice. So the point about this presentation is, whenever you have a central catheter placed, it's very important to look at two things. First of all, the tip where the catheter sits, which is very important, because if this tip is deep in the atrium, that's not the place you want the catheter to be. So that's why it's very important to look at that. Second thing, if you're worried about obstruction, the Doppler is the best way to look at the flow and the placement of the catheter. And here you don't see any signs of any obstruction. So that's good. The third part is, of course, looking at the site. Because this is a tunneled catheter, you just have to make sure where the incision is made, the incision looks clean. Like I said, this looked a little deceptive, but the incision cannot be this large. So that's why, like I said, the neck is bent all the time in premature babies, so they can collect some debris there. So again, this was a normally placed Broviac catheter. I hope you guys have learned something together today. Please do like and subscribe to our channel and share with friends. And you guys have a wonderful day. Bye.